My name is Callie Hunter, and I'll be demonstrating how to do a subcutaneous injection. So first thing that I want to do is check my physician's order to verify that I do have a medication that I'm going to be giving subcutaneously, which would be into the fatty tissue, locations being the back of the arm, the abdomen, the thighs, pretty much anywhere we do have a subcutaneous tissue. So I want to get the appropriate needle size for that. So I am going to be administering insulin today. So I'm getting a 29 gauge half-inch needle, so the needle length is a lot shorter than it would be for an intramuscular injection. This is also in units, which would be specific for insulin. So next thing that I'm going to do is check my physician's order to check my medication to ensure that I'm giving the proper dosage of insulin, and I will be giving 5 units of Humalog today. So again, I would also do my 6 checks there for my medication administration. I'm going to go ahead and draw up my 5 units of Humalog. So I'm going to go ahead and alcohol swab my insulin vial. I'm going to draw back my 5 units. Okay, and I've also verified that I do know the peak of this insulin that I'm going to give and the onset and duration, so I can ensure that I know those things prior to administering this. I'm going to go ahead and pull back my 5 units of air. I'm going to go ahead and inject the air, and I'm going to pull back my 5 units of insulin, making sure that I don't have air bubbles in there. Okay, next thing that I'm going to do is just again scoop my cap here. I'm going to quickly have another nurse verify my insulin, that it is correct, the 5 units with my order. Next thing I'm going to do is enter my patient's room. So knock knock. Hi Mr. Jones, my name is Callie. I'm going to be your nurse today, and your doctor has ordered us to give you some insulin today. So I do have 5 units of Humalog. Can you go ahead and verify your name and date of birth? And that is correct with his wristband. And he has chosen to have the administration in the back of his arm, so the posterior side there. So first thing that I'm going to do real quick is wash my hands. So I'm going to wash my hands. I'm going to apply gloves. I've also already verified his blood sugar levels to make sure that they are appropriate to go ahead and give this Humalog. Okay, so next thing that I'm going to do, and again, he has chosen to have this in the back of his arm, so I'm going to kind of pinch up that area. I'm just going to loosen the cap here on my syringe. I've got my alcohol swab here, and I'm going to pinch up that area, and I'm going to wipe inner to outer. Just going to allow that to dry a few seconds. Again, I'm going to hold this injection like I would a dart. I can pitch up a couple inches, therefore I'm going to inject this at 90 degrees. If I did have a patient that I could only pinch up maybe an inch, then I may want to do 45 degrees instead of 90. So Mr. Jones, you're going to feel a little stick here. 1, 2, 3. Okay, I don't need to aspirate this, so I can go ahead and inject this medication or this insulin. I'm going to pull straight out. I'm going to safety lock, and then I'm going to release that. I don't need to massage the area. It's not a vascular area, so I don't need to apply a bandage, and you really shouldn't have bleeding from this site. So lastly, I'm going to go ahead and dispose of my insulin syringe in my sharps container. I'm going to remove my gloves and clean up my area. I'm going to reposition my patient, making sure that they are comfortable, their call lights within reach, their side rails are down, the bed is low, and I'm going to wash my hands. And that concludes subcutaneous injection.